Good afternoon, class. Today, for our discussion, we will be talking about the migration from the traditional drugs and alcohol addiction treatment to the computerized digital technology and telehealth intervention. In our overview, we said the expanding and use of digital technology in mental health, drugs, and alcohol addiction treatment has widened the scope of emerging addiction intervention. This review will focus on the use of technology to advance the field of drugs and alcohol addiction treatment. We will discuss about how to advance the application of computerized technology can be useful in the implementation of our addiction. And our research is going to be focused basically in the lower community, lower Massachusetts. Introduction. The internet-based technology now provides the capacity to merge an efficiency of evidence-based treatment with the advantage of wide-reaching technology. It allows interactive response and allows face-to-face interaction between counselors and individuals with addiction problems. In substance use disorder, the SUD management provides a tailored support and how crucial the role it plays in the treatment of addiction. We said around 65 to 70% of the population with addiction and drugs related issues living in the lower area are now exposed to the use of smartphone, especially with programs offered by nonprofits through the financing of the state of Massachusetts, giving individuals who are homeless the opportunity to free smartphone, even give them access to internet and other websites that connect them with addiction counseling. The use of technology may help clinicians reach people with addiction problem remotely, especially individuals who may be deprived from the service of addiction treatment. There are some individuals who live in remote places. There are some individuals who live in cities where there are no treatment facility or detox, a detox, a TSS, or CSS, or halfway house, or other long-term treatment facility. But with the use of digital computerized technology, individuals can easily search websites to have access to where this facility can be located and how can they be admitted into treatment. You can now sit from your bedroom and get in contact with a clinician who can have a therapeutic session with a patient or with an individual who is struggling with addiction problem just by Zoom meetings, telehealth, and other related digital computerized technology. It is now very important as we further discuss on how technology advance could help us overcome the barrier and improve access to substance use care. I want us to take a look at the use of computerized intervention for addiction with specific situations that's happening within the lower Massachusetts area. This research is concentrating on the use of technology in an addiction and will focus on the relationship between the exposure of craving and active substance use. The advance in technology and how it have made it possible to provide therapeutic intervention at the time when it is needed. Recently, there are other applications the FDA have approved, like Reset, like Evolve and other computerized technology that have now shown significant increase in the substance use rate, and how this technology have been able to centralize addiction treatment between insurance, treatment facility, patient biosocial, that with the use of those technology, you can easily be able to have access to the patient history and other related information that is associated with the trauma that have brought this patient to the use of substance. These type of applications include but not limited to the multiple modalities that have been tried in mental health treatment since its foundation. Now, there's no way we can discuss mental health without discussing individual, because I believe from the birth of man, men have struggled with trauma, but from time to time, the way we treated it, the way society intervened was different. But now people can have different type of therapeutic interventions because of the use of computerized modern technology. Let's look at progress that have been made so far with the use of computerized technology. One of the first things we're going to be looking at in this discussion will be the web-based self-help intervention. These are self-guided programs providing either basic information and intervention or information only. These type of programs are executed through the structural website where the client can explore information provided at their own pace. These type of intervention can be subdivided into four type or four categories based on required information as communicated. Let us look at uh, the first category. We say information and education-based intervention. With the use of technology or computerized technology, this type of program are structured to enable clients to access information regarding a specific problem or symptom. For instance, if you have mental health issue, you can be able to get on the web page to look for a clinical facility that is helping people with therapeutic intervention. You can use the website to access clinical facility that is treating drugs and other addiction problems. And these web-based specify specific disorder diagnosis and criteria. They also look at the costs and the treatment strategy. The aim of such intervention is to provide easy understanding of the basic information about addiction-related disorder. And these also provide link to other websites that can be helpful or provide helpful information for individuals who need assistance. The second one we're going to be looking at would be self-guided web-based therapeutic intervention. People with addiction problems have benefited a lot from what we refer to as community meetings, where people can meet on the daily or bi-weekly or weekly basis, but time that they all agree to meet, and they can be able to share their history, the trauma that brought them to the use of substance, how they deal with their addiction, how they survive their addiction, and how recovery have been beneficiary. So with the use of the self-guided web-based therapeutic intervention, individuals can now meet via Zoom meetings and other website related meetings like Google meetings, FaceTiming, and they can share their story with individuals. And this have been very much helpful. Emails, telehealth, and other related programs. The third one would be human-supported therapeutic web-based intervention. It is similar to like the community meetings, but they look at Zoom meetings. Even with COVID-19, a lot of patients have stopped going in-person hospital visit, but instead have met their PCP by way of Zoom meeting or other telehealth related interventions. So patients with addiction problems cannot meet the therapist on the daily basis. As compared to the past, you have to book appointment and there may be hundreds of people that are ahead of you and you have to wait on a weekly basis. And while you are waiting, you are still using because addiction itself comes with cravings and you name it. And when there's craving and there is no one to seek help, it comes with a lot of other mental health and other related problems, and patients definitely will use when they crave. But because of telehealth, Zoom meetings, you can now call a counselor, a therapist who will provide you counseling, who will provide you help and other assistance as needed. So the human supported therapeutic web-based intervention is also important. And of course, the last and but not the least is therapeutic educational system. We said this is a web-based psychosocial skill training intervention for individuals with substance use disorder based on the validity of the community reinforcement approach to behavior change. As you all know, when people start to be substance dependable, there are a series of changes that happen within their life as a result of being exposed to the use of substance. And it has different interactive multimedia models, starting with the basic quantitative behavior skills. For example, refusal skills for risk behavior management, like self-harm or other harmful thoughts. So there are a lot of things that happen with people who are exposed to the use of substance. But with the use of computerized technology, you can get on the website and get some therapeutic education as to how to help yourself deal with your mental health trauma or your addiction situation while waiting for help. So it's very important. Let us look at some of the barriers that drive this change from living to the traditional treatment of addiction issue using paper, pen, and meeting in one community room to computerized technology where people now use telehealth. What are some have been some of the barriers? We say that introducing change in any organization can be a very big challenge. In some cases, people are not able or people become a little hesitant to accept change and will argue to retain the status quo. And this can be a barrier to organization. A lot of people are used to doing certain things in a particular way. And for every time there is a change that is driving an organization to use another method that could be more efficient and effective, it can be a very serious barrier because a lot of people struggle with adapting to change. And we say another great barrier could also be, or some of those changes, excuse me, some of those changes can also be training. Like we're talking about the use of computerized technology. A lot of old folks are not exposed, were not born in the internet age and are exposed to the use of different technology. A lot of you got smartphone and don't even know how to use your phone well. So now getting exposed to the use of different computerized application to make your work a little more efficient can be difficult. Some people are going to grab it very fast, and some people will be a little slow, struggling to use all those different computerized applications, and that can also lead to low productivity. People not meeting goals on time, people not meeting targets because a lot of people are still behind trying to catch up with the use of computerized technology. We say financial cost. The cost of technology also can be a very huge barrier. Um, Computers, smartphone, internet, the purchase of applications, the maintenance of those computerized equipment can be a little cost intensive, and that can be a very big barrier. The next question will be, why am I the right person to lead this type of change or innovation? I believe that to be a leader of change, you got to be foresighted, and you got to have vision. You got to be proactive. You got to be sociable and interactive to be able to identify folks that can work on your team to drive the kind of change. You got to be able to communicate your goal in a clear and timely fashion that people understand that goals are divided into phases, phase one, phase two, phase three, but at the end result, this is where we are now. This is where we expect to be in the next 1 year, but in the next 1 month we expect to be at this reach. I mean, you must be able to communicate the vision in a clear fashion. You gotta be authentic to give opportunity to the people that work along with you on your team to be able to know without a lot of verbal communication where you are and where you expect to be or in the next distant future. So you got to be a team builder. You got to have great communication skills, your ability to make your vision as clear and understandable. You got to have those interpersonal social skills, and of course, a great leader must be a motivated leader. And with those characteristics, you are able to drive the change without no derail as we work in using our computerized technology in the use of addiction and other treatment in the lower area. Oh, thank you for listening to this presentation. We look forward to your comments, or your criticism, and your recommendations. Thank you and have a great time.